Okay, so my next athlete is a soccer player who has suffered superior tib-fib sprain. They have a history of chronic sprains. However, I'm assuming in this situation for return to play that they have had an acute episode to make it flare up. So the first thing I would do is check for swelling. If there is swelling, I would do a light milky massage, so elevating their leg, just doing some light milky massage to bring some of the swelling towards the lymph node and get that drained away. Next, after that milky massage, I would check to see how it's feeling and then move on to a tape job to try to see if they can return to playing soccer. So first thing I would do is check PMS distally, so I would check for a tib post pulse, and then I would check for sensation, so making sure that they are able to tell me what toe they're touching, and making sure that it doesn't feel different than other parts of the body, and then a motor check, so getting them to wiggle their toes to make sure that they're able to do that. Once PMS is clear, I would move on to a tape job. So since it's the superior tib-fib sprain, I would get a piece of leukotape and go find fibular head, and I would put the piece of leukotape on the fibular head and pull the fibula towards the tibia, and then I would do 3 pieces of leukotape just like that, just to try to bring the fibula and the tibia closer together to reduce any movement of going apart, since that is where the sprain has occurred. That's the ligament where the sprain has occurred. So I would do the leukotape, pushing it towards the tibia, and then I would take tensoplast or light plast, and I would further tape fully all the way around the calf, making sure that they're contracting the calf so that it doesn't get too tight later. So then again, I would use tensoplast or light plast to go all the way around a few times, and then I would end with zinc oxide to cover up the ends to make sure that it doesn't lift during the soccer game for potential of it coming off. And so then again, that's around the proximal tib-fib. So then after that, I would recheck PMS. So I'm going to go back down and check for a tib post pulse. Make sure that that is present. I could also check dorsal pedis pulse, whichever one is most convenient. And then I would check for sensation. So I would make sure that they're able to tell me what toe that I'm touching, and making sure that the sensation doesn't feel unnormal or not normal. And so then I would check motor one more time, get them to wiggle their toes. Once PMS is clear, we're going to move on to functional return to play testing. So since they're a soccer player, they're doing a lot of running, so we're going to do some running progressions. So the first one, you're going to just run at 25%. And once 25% is cleared, pain is below a 5 out of 10, then move on to 50%, 75%, and 100%, making sure between each progression to stop and check pain scales and making sure that it's staying below a 5. So next, since they're not always going to be running in a straight line, we're going to do some side shuffles, going to the left, going to the right, making sure that they're able to do that. And then we're going to get them to do some running that ends in a cut or in a pivot. So we're going to do that again at 25%, 50%, 75%, and 100%. 100% being a full sprint with a complete abrupt cut, pivot, moving the other way. Again, between all of these, making sure to stop and check in with the patient or with the athlete and making sure that their pain is staying well below a 5 out of 10 pain scale again, and making sure that they're able to do it how they would normally do it. So again, if you don't usually watch them and you don't know how they would usually look running and cutting and pivoting, maybe asking the coach to say, oh, is this how they usually go, if something seems off to you. Just making sure that everything is normal for them and fairly pain-free. So after you've determined if they can return to play or not, if they cannot return to play, move on to educating them about icing and compression. If they can, then making sure that they come back to you to educate them again on icing that injury, I'm sure if it's a chronic injury, they're very used to it. However, making sure that they know about icing, compressing, and elevating that injury to try to reduce the swelling that happens there. And then again, they can come back and see you for rehab, getting that swelling out of there with the milky massage. And possibly, if it's a chronic condition, it may be an issue with the bones, so how the talus is positioned or something like that. So if it's a chronic condition, then later on you can try to see where the talus is, do some joint mobs, that kind of thing. But for the functional return to play, the milky massage and the tape job is the direction that I would go in.